lumbar 17, okay?
Alrighty.
Like I said, a little colder.
And I spent a lot of time dwelling, especially going into that surgery, I spent a lot of time dwelling on, is this the end?
Fine for now, or like? See you soon.
My colon cancer metastasized to the liver, and it was all throughout my liver, both lobes. I was told I had 6 months if I did nothing, and if I was on chemo, I'd have 2 to 5 years.
Everything turned upside down that day. I mean, I fell on the floor, I was hysterically crying. She was like, I'm so sorry, it's metastasized to the liver, and it gets bad. I mean, that's all we heard, it's bad.
He was told that there was no surgical options and there was nothing else to offer to him besides systemic chemotherapy, and that he didn't have a really long time to live.
It's such a helpless and scary feeling to feel like maybe we beat this, maybe we don't. We have no idea.
So your choice is, do you follow the conventional wisdom, or do you want a maverick?
For colorectal cancer in particular, the majority of the patients who have spread, the most common side is the liver itself. That happens in about 50% of the patients throughout their treatment. A very, unfortunately, small number of those patients are resectable. About 20% of patients who undergo a liver resection are cured. And that's usually defined as no disease recurrence in 10 years.
Next, we met with Dr. Gholami, and it was like, sort of enlightenment. And we decided to go down the path of the hepatic artery pump, which took me to my first surgery, basically.
HAI is a form of regional therapy for patients with spread of tumors to the liver or even primary liver cancers. It's basically using regional treatment and therapy via a catheter that is placed into an artery that feeds the liver. And the reason and the rationale that we can use this is that these tumors really get their blood supply from the hepatic artery. So we really exploit that system and give the treatment directly via the artery.
The goal was for the lesions to shrink. And every time they went in and checked them out, the lesions had shrunk.
The dosage of the drug that goes into the pump, called FUDR, is about 400 times higher than a typical dose of the drug that you could give in a systemic fashion.
So I was getting both systemic chemo as well as this thing that's 400 times in my liver.
The drug itself is delivered to the liver only, and it really doesn't get to any other organs in general.
Some of the lesions in my liver, I think, were between 2.5 and 3 centimeters. And by the time they had, the hepatic artery pump had done its job, we were down to a millimeter or less on a few of them, which is essentially nothing.
For Grady's case in particular, so he had basically his disease spread was across both of his liver lobes. So the plan, what we did is what basically placed the pump in addition to also remove the tumors on his left side. Once he then got the HAI treatment with the systemic therapy together, he had such a good response on the right side that we were able then to go in a second stage and remove all the tumors on the right side.
All right, let's go. And so when we looked at the scan, there were only like 3 lesions left on the right side. He's had an incredible response, and today's job was really to remove those and burn one of them, and we're now done, so it went really well. Oh, it's out. So, this is good. I mean,
are you like seriously telling me that
like it's all...
It's out. It's out. It's gone. With
yeah,
the out.
it's all gone. So, I mean, we'll do that last one with the scanner. We'll see what I can see. If there's anything. I think
A year ago,
worked really well.
A year ago, he was told he was not able to have surgery. Not by you.
I know.
Not by you.
I know.
That's why we are here. It was because you said I could do this, and you did this.
When patients are giving that information, they want more hope, right? They're looking for anything else and other options. And in Grady's case, he's tumor and disease free, which is really incredible. And that's just in a very short time of less than a year.
Hepatic artery infusion pumps are really a great advancement in the treatment of liver disease. And that is why I recruited Dr. Sepideh Gholami to come to Northwell and to start a hepatic artery infusion pump program. And it's been a huge success.
And I hope that more people will learn from my experience. Hopefully they will have a colonoscopy earlier than I did and they won't go through this. But if they do go through it, don't give up, because you're going to find your Dr. Gholami, and it may be her, and I hope it's her, because she's the best.
Well, you look good.
Yeah, no, thank you. I'm feeling good, and just...
I'm planning my life. I'm imagining a future that I didn't believe I had. Even as recently as 6 or 9 months ago, I did not believe I had that. And had it not been for Dr. Gholami and the hepatic artery pump, I don't know if I'd be sitting here today, but if I was, I wouldn't look like I do right now, which I think hopefully is pretty good.